It challenges one of the most common procedures used on more than 1 million Americans each year to unclog arteries and relieve chest pain. Researchers looked at more than 2,200 patients. The findings suggest drugs alone work just as well as angioplasty and stents in patients with stable angina. And we're not talking about high-risk patients who have chest pain at rest, in other words, when they're not exerting themselves. We're focusing on people who have predictable pain with exertion that goes away promptly.
You have choices now. You can elect to have medical therapy alone, drug therapy. And if you do well, you may actually become completely free of symptoms in the first year.
Well, the study was designed to see if stents work better at preventing heart attack, stroke, hospitalization, and death. In the end, researchers concluded stenting through angioplasty and administering drugs versus the drugs alone work about the same.
But doesn't angioplasty just work on one artery at a time?
And that's exactly what doctors are saying. Dr. Nissen told me that angioplasty works on one blockage at a time, but the drugs affect all of the arteries and all the plaque that causes the blockages. So when you implant a stent in an artery, you're only treating 1 to 2% of the plaque, so you can see the difference.
Okay, so when it comes to taking these drugs, how do you know which ones are most effective?
Well, there are a couple that you've heard about a lot. For instance, statin drugs that lower bad cholesterol, blood pressure medication, and blood thinners such as Plavix and aspirin. Now, for people who are already on these drugs, Dr. Nissen told me they may not be getting the aggressive treatment that's needed to make a difference in this
Again,
case.
like we said, it's exciting, but it's controversial at the same time. So, as people are thinking about this, what should they be asking their doctors?
Well, they certainly should be asking their doctors a couple of questions. Again, if you're not in the high-risk category, you should be asking if it's reasonable to try medicines first before undergoing angioplasty. It is an invasive procedure. Dr. Nissen tells me if the drug therapy is not effective, you can always have a stent implanted later. By deferring the treatment, he says, patients will not be putting themselves at risk. Now, if you're already taking these medications, you should be asking your doctor a couple of questions. Are you getting the best results? Is your cholesterol low enough? And is your blood pressure low enough, Betty?
And when you look at the two different types of treatment, talk about the cost, because it seems like one would be a lot less than the other.
And that's true. We're told by Dr. Nissen that stents cost about $25,000 to implant in the hospital, including doctor's fees as well. Dr. Nissen says the study results are expected to increase cost effectiveness.